Hello, everybody. Welcome to AI Live.
I know. Welcome to AI Live.
I know. We're reading. We have so many things to talk to you guys about. We're kind of going through everything, so it's kind of fun. We have a lot of new things coming up, and we've done a lot in the last month. You've been busy.
A little bit.
You had the expo last weekend.
Expo for some other things that I play around with in the wellness world, and so got to learn a lot about the wellness. Got to sit in this like super cool hyperbaric oxygen chamber. They're starting to get some really good, that was by, I think, Oxygen Health Systems. So it looked like a Rolls Royce. I mean,
wow.
But they actually make ones for home usage. They will go to like 1.2 atmospheres, 1.5 atmospheres, and they only run like 15,000-20,000.
Really?
The Rolls Royce one was like $140,000.
Wow.
But that one, like you sit in it, it's like you're sitting in a Rolls Royce. And it was actually really cool. And then all the different things. There's just so much in the wellness world, and just learning about it all and trying to absorb it all. I think the aesthetics industry is primed for moving a little bit, integrating it all and stuff like that. So I'm excited to see kind of where all of this plays out. We brought in some of the Korean brands, so I'll be hopefully maybe trying to share some of the new Korean stuff beauty trends that are going down. I actually got to meet like BioPlus, the president of BioPlus, which is one of the top, like behind like Samsung and blah blah blah.
Wow.
They make a ton of different fillers.
Oh.
And toxins
in Korea?
From Korea that they're slowly going to be bringing into here. So look out for the Korean overtake because they are coming. There's the new machine, and preemptively, it's not being sold just yet, but probably they will only have a very limited amount this year. Next year they'll probably open it up, but it literally is this. It's this super cool like kind of air thing that literally you attach a little syringe, you drop your serums, and it literally can push it. Felt nothing. Like you don't feel anything. It just, you can do lymphatics and stuff like that. But it pushes it. You can push into the epidermis, the dermis, the fat, because they actually said you can push fat dissolving things into the sub-Q, and it can get even down into the SMAS. And then they have ones that even push, or you do over the joint spaces, and it can push into the joint spaces a little bit more. So
Wow.
So when you get into that, there's potential like pinpoint bleeding type of stuff, but that sounds really, really cool. You're not going to be able to push HA because I think the bigger HAs, like when we talk about fillers, are too big, but I think they go up to like 10,000 kilodaltons.
Wow.
So those that have those, those transepidermal things that people have in their offices where you can take some serums and actually rub over it, and it opens up some of those bonds that actually push
not
through.
saponification, but there's a word for that. TJ's got it.
Yeah. Yep.
Iontophoresis.
Iontophoresis type of a thing. Yeah. So there's some really cool things, and that machine isn't super expensive.
The device that I'm trialing now is called Energet from Sinclair.
Yep.
That one, you mix HA product with saline, and that'll take it into the dermis.
Yeah.
So,
this one is more for like more serums, a little bit of consistency. They make a whole exosome line stuff that I was trying to understand, a little lost in translation because they speak more Korean, but theirs is actually more tailored. They're actually doing it with less immune response, because that is one of the things in the exosome world people don't even talk about is, you get it from a person. So is there a little bit of the HLA and blah, blah, blah. And so this one, less immune response because they're getting into the trophoblastic arena in that aspect of it. So I need to delve into that more to learn more, but they have it specifically for the hair.
Yeah.
So they've actually merged it from the progenitor cells of the hair. So you get all of those that deal with hair, and then the progenitors of the skin to actually focus on skin. So they're getting much more specific with regards to
because the only
exosomes.
skin progenitor cell product I know of is Provoke.
Yep.
That's the one that is made from the skin progenitor cells, and you get the secretomes from that. So that's what I have in my office.
So this is
exosomes I worry about a little bit. Now we're learning more information about them.
Are exosomes.
There's exosomes in them, but but I think sometimes people don't know what the source is. Where's it coming from exactly? And what are we transferring? And, we know with the study that the lyophilized exosomes are non-existent. There's really not much in there. So we're learning more and more and more. And this is interesting stuff.
So much more interesting. Like, I'm super excited about where this is going. So we'll see. Yeah. But we do have some housekeeping before we get started. So let's get to it, Lori, what's going on?
So we have Dissecting Aesthetics coming up, you guys, and we have a couple spots left. This is going to be amazing. It is August 16th, 17th, 17th. So it's not this weekend, but the following weekend. So it's about a week and a half away. It is going to be with Dr. Julie Woodward, who is an oculoplastic facial surgeon out of Duke University, published more than I can even imagine. I could never read everything she's published. She's published so many things, and brilliant mind. Beautiful anatomist, and she does wonderful with dissection. So she's going to be leading this dissection with us, which we're so excited to have her. And then Gideon's going to be here. I'll be here. Julie Bass Kaplan, who's a wonderful friend of ours. We love her, who has her own cadaver course up in Washington actually Oregon and Northern California. She's going to be coming and hanging out with us. So the four of us will be leading the course, and it's going to be really, really fun. So that's going to be August 16th, 17th here in Brea, California. So if you can make it, please try to make it. It's going to be amazing. We're going to throw some injections into there. It's 2 days. This is not a one-day course. The first day is all dissection. The second day, we are going to be injecting, ultrasounding. We're going to be doing a lot of really interesting stuff beyond cadavers. So it's really going to be fun.
It will definitely be fun. We also have a Foundations of Advanced Aesthetics. So you guys that are newer into the aesthetic industry, that really want a strong foundational class, if you guys know anybody that's looking, this is a great class. It is very, very strong. And so this is called FOA, and this is going to be September 20th. There are those that also want to just get more time on tissue. So if you do reach out to the team, you can actually just come in and actually just have us guide you injecting different areas, like maybe temples or lips or chins, areas that you have not done for the newer injectors. So definitely reach out. That is our Foundations of Advanced Aesthetics course. That's going to be September 20th.
And you do have a hands-on for that day. That is a CME course. So keep in mind, you don't have to have a license in California to come. We're CME accredited, which means we're an educational facility. So you can come to California and we can teach you, and you can do hands-on and have your model and be okay as far as your license. So a lot of people might not understand that, but it's a great course. It's all day long. But you do have to do about a 12 or 13-hour didactic prior to coming to get your CMEs. And that didactic, which is an amazing information in aesthetics. I think we've had people who have actually been KOLs take our course, and they said they learned so much from the didactic. We give you a year to rewatch that with this course. So it's really nice.
All right. And tied into today, we are going to be talking about IVs. Why, as I talked or when we first started, we're talking about wellness. When we're doing things for aesthetics, it really is tied into everything from the inside out. And so we decided to partner with Dr. Sammons, and we had her come in and help film. She did over 6 hours of videos on IVs, everything that you need to know about IVs as a whole coursework. And so this is going to be available now for under $500, $497. So I think all of you guys that want to get started, want to learn more about it, this includes the complications, the business aspect of it, patient live demos and stuff like that. So you're going to get to see it. We're going to talk to her today about it and why it's important. And we're going to just hopefully you guys enjoy the series, and we'll continue adding more series that we think are important for you guys as the aesthetic arena starts to expand beyond just aesthetics. It really is more encompassing into the wellness world. So $497, guys, it's a great price to really jump in and get your hands wet with IVs and really learn it in a very succinct way so that you can bring it into your practices very quickly.
Yeah, and you know what? You want to be safe with what you're doing. You don't want to just throw a bag up there and throw some vitamin C and some, different types of things in it and give it to your patient, because there can be problems. And you really have to know your patient's pre-existing health history. There's so many things you need to know, and you need to now know how a lot of things are metabolized and how they are mixed. And it's really important to understand what you're giving your patient. So Dr. Cortez, Dr. Sammons, who is here, Dr. Sammons Cortez, who is here, she has 6 different names.
All of it, all the
Jackie.
names. Yeah.
She's here, and she's going to kind of break a lot of this down for us. And like we were saying, super important that you really know what you're doing and why you're doing it, and you do it safely. So that's why we have her here today, and that's why you need to take this watch this video library that we're offering to you, because it's going to help you be safer with your patients, and you can rewatch it as you need to. A certain amount, I think we give it to you, so it's amazing.
Sure.
Yeah, thank you guys.
Let's see. We are going to do a business thing. We have Gideon Kwok and Jared Rohr. It's going to be September 2nd at 5 p.m. with us on the next AI Live. So don't miss out on that, because it's going to lead into a whole business series for you guys that are interested in the business side of the medical aesthetics industry. So I think that is really important to know.
Yep. And then keep in mind, we have mentorship spots still available. So we have 3 different tiers of our mentorship program. Every tier has got amazing information available to you, and it's not too expensive. It's kind of like a lot of people have Patreons nowadays. Just look at it as our AI Patreon on crack. So you have so much information and videos available to you. I think it's really important, and it's valuable for you to join the mentorship program. We have a call with our Founders Club, which is the highest level, every day after this show. So we do a live Zoom with all of our founders, and we're able to talk to them and kind of find out what's going on and what problems they've had in their clinic, and really be a mentor, which is what this whole thing is about. That you can send us questions, you can talk to each other on a chat board, and really help to get a lot of questions answered. We want you to have support. That's why it's a mentorship program. We want you to have support. If you don't have somebody next to you in your clinic or down the street, or somebody in your clinic that can help you answer these questions and support you, that's where these programs, that's why we developed this. So that's what that's for you.
Yep. And lastly, we have our Foundations for Aesthetic Injectors. This is going to be hosted by one of our amazing friends and faculty here, Janelle Ocampo. It's going to be October 25th. This is for the people who are just delving into the aesthetic industry, newcomers, people who want to peer over the fence and learn about the aesthetic industry. So all of you guys that have friends or family members and that are interested in jumping to aesthetics, this is the class for them. This gets them their feet wet. It helps them understand what we do in our field. It gets them the knowledge base so that they can actually make a decision. Is this a field that I want to jump into, spend some money, spend some education dollars in to really jump and move into a new career? Because everybody's always looking to expand and jump into something new and fun. And so October 25th is when this class is going down. So let your friends know. Let your nurse friends, your doctor friends, whoever it is, know about this class, because I think it was so well received. We just did one about 3 weeks ago, and it was a packed house, and people really are starting to jump into this field, and we want to make sure that everybody jumping into this field is going to be safe. They understand why they're getting into it, what it's all about, so that we promote this field in a positive way, and so we grow all together very, very well without all the bad.
So in this class, they don't inject people, but they will practice with products. They press jelly out of syringes and practice drawing up toxins and mixing. So there's a lot of good hands-on to do, but it's not necessarily injecting a live human. So that's where this is really good for people who think they want to get into it or are brand new. They get a good foundation and then they can kind of play around with the jelly and get a lot of questions answered. So it's a really good course for newbies. It's really good.
Yeah.
Yeah.
Okay, so we're done with housekeeping.
Okay.
We get to jump in and really talk about IVs. You guys get
comfy.
Get comfy, get comfortable, and really write questions in. Let's make this an interactive thing because we want you guys to get educated about this so that you guys are well prepared to start an IV practice in your clinics and what to watch out for, what to, that whole 497 will include some of all the paperwork that you need with regards to it. So you're going to get the whole package. It's like literally a nice package you just unwrap and you can start on that aspect of it. So 497. But I get to introduce my friend. We actually went to med school together.
It's wild. At least
right?
5 years ago,
Yeah, 5 years ago. That's when we graduated.
No, we started. Do you know we started in '99? We're going on 26 years since we started our anatomy class together.
Mm-hmm. We spent the whole
I'm
summer.
only 27, but I think we
started
look
from the
good.
womb.
Yes, for sure. It's
But
crazy.
Dr. Jacquelyn Sammons, she is a OBGYN by training and literally got fed up with the medical traditional world. And I pushed her and I said, you have to do this.
Yes.
You have to help the wellness industry. And so she's taken it by storm and it's so amazing. We're just starting with the IVs. I'm pushing her to do one on actually bioidentical hormones.
Yeah.
I think all of you guys
doing
need
that later
to do
this
that.
month.
She's gonna start that filming process, and so it's probably gonna launch in the new year. So watch out for that because I think a lot of you guys want to learn more about that. It's very important. I mean, as we learn more about it, I think the whole understanding of wellness and aesthetics and making it all work together, that synergy, it really is understanding your patients and really treating them in totality.
Yeah.
So
I agree.
thank you for coming,
Yes,
Jackie.
I'm so excited to be. I had a little.
I saw
I
it.
see
I
that.
saw it on.
I just saw you on Friday. I'm like,
Right? What happened?
I saw it on Instagram. You're in the ER.
Girl,
Was it broken?
I cannot. No, I don't know yet. So
It
not
looked
broken.
Yeah, it looked like you chipped it though.
Yeah. So I'm not sure. And so I got an MRI this morning, and we're waiting for results. But they think I may have avulsed the flexor hallucis brevis. So I'm not allowed to extend or flex. So we're just laying low with the little boot.
Got your boot.
Does not hurt, and I will
Okay.
tell you why. It does not hurt because arnica is amazing. If you guys are not using arnica for your patients for preventing bruising for your aesthetics and so forth, please do. Arnica is amazing. And then we've used BPC 157.
Oh, there you
So
go.
a little bit of local subQ peptides 2 days in a row. And then today I just got my first dose of True Dose, which is PRP on steroids. Like, it's so amazing.
That one's a really good one.
This
What
is
she
a
was
really
telling
good
about
one.
that.
So
Really?
I'm gonna, if we have time tonight, I'll fill you guys in a little like sneak peek.
Yeah.
So what was interesting is kind of on the heels of what Aesthetic Immersion has put together of saying like, hey, we need some foundations. We need for the newbies. I don't know about you guys, since I don't know how many of you are out there, but I don't know about you guys, but when I go to these conferences, they're talking at 30,000 feet level.
Oh, I know.
They're talking about, oh my gosh, I had this one case and we did this, and it was so great. And they're off the reservation.
Yes.
They're going so far.
Of course.
And when you get into aesthetics particularly, there's an artistry to it. There's this beauty to, I mean, obviously it's a beauty industry, but it's, you're looking at muscles and this dynamic and contralateral muscles and opposing muscles, and it's so much. It's so much.
Yeah.
And so that's the art. And so today when I was learning about True Dose, she's like, and so the art of it and da-da-da-da. I'm like, no, I don't want the art class. I'm not ready for art class. I want math class.
Yeah.
Right.
I want exactly what I should be doing, how it should be done each and every time. Let me establish the system first,
Yes.
a basic understanding. Then we can play with art class and throw
Right.
finger paint at the wall, and that's great, and it's so fun. And that's what I felt about IVs. A lot of the IV coursework out there is we're pushing phosphatidylcholine, which is a fat-soluble molecule, and it's remarkable, and you're talking about mold patients and chronic Lyme. Girl, don't start there. Don't start there. That's not the beginning course, right? Beginning course. How do I start an IV? What are the things that I need to purchase?
What's in a banana bag?
But what the hell's a banana bag?
We used to give an ER all the time.
Yes, when we started back in the day, because you know, Dr. Kwok and I, Gideon and I, started when dinosaurs were our classmates, and so you could just order banana bag IV. That's it. And then in the midst of our training, they actually decided like, no, you can't write that. You have to write all the different elements, and so we had to study. And nobody wants to do that. So, you know, it became more complex. And then there's added layers and added layers. So, yes, you can get super fancy with IVs, but I wanted to make this a fundamentals course so that you can feel safe, starting it in the practice and implementing in and amongst all the other amazing things that you're doing while they're getting a hydrofacial, while they're getting a PRP microneedling, while they're doing their the little EMF, what do they call it? The sculpting, M-sculpt. Yeah. See, I'm not there, girl, because I only have so much square footage and I have to decide what's going to take up the footprint. So I do more of the ozone and true dose and other PRP therapies for joints, so much more so than aesthetics per se. But there's definitely this role for this regenerative type of therapy in adjunct to your fillers and your neurotoxins and the other elements that you're bringing to your patients, because you're fixing inside so that it is emitted on the outside. So once they've trusted you with the outside, now you're like, but girl, we gotta fix what's happening here. Why do you have to keep coming back? Why are you chewing through your neurotoxin this quickly? How come, you know, your face is the way that it is, that with the decrease in elasticity and so forth and the collagen and whatnot? Then let's augment that process by helping you with the IV therapy. So that's what we've devised.
So where did you even get started? From OBGYN
oh my goodness,
to IV therapies? Like,
are you ready? It predate. Yeah.
like,
okay.
Where did that
So here's a funny story. So when I was like 15, like I knew I wanted to be a doctor since I was like 3, right? Like literally remember looking up at people's kneecaps and telling them I was going to be a doctor, right? And they're like, so cute, you're going to be a nurse. And I'm like, no, I want to make the decisions. Like I want to be the doctor, right? So I knew very early on. But then like through high school and then I graduated early, whatnot, I'm like, I need some volunteer experience. So I go on and start volunteering in the ER, and literally all you do for any medical student wannabes out there, all you do as a volunteer is you get ice, but only to some patients because other patients can't eat it all, and blankets. And what else are you able to do? Water sometimes. You can call the lab and wait on hold, and then when they pick up, you immediately hand it to somebody who knows what they're doing. So I'm like, I'm not getting any hands-on experience. I want to really learn what's happening. So a local vet was a friend of a family member, and so I went ahead and became a vet tech. And at the time, again, there were no like certifications for this. You just did on-the-job training. So I learned how to scrub for surgery. I learned how to prep a patient. So they were furry patients, but patients nonetheless. We extracted teeth, like we were intubating dogs, cats. We had to start IVs in their little forearms. And so you'd have to shave off the little forearm and like pull off. We didn't really use tourniquets, so you just use your thumb and then feed in a little tiny catheter. And these are like puppies, kittens who are getting spays, neuters, 6-month-old animals, like little tiny veins, tiny catheters. And of course, our doctor, as sometimes doctors will be, is a little temperamental. So if you wasted a whole bunch of equipment because you couldn't get it, he'd get pretty miffed. This is $3. Do you know how much these cost? And like he would dig gauze out of the trash can. You can re-sterilize this. I'm just kidding. He didn't do that. It wasn't quite that bad, but it makes a good story. So I learned how to do it then. So as I left kind of that Western conventional approach, and I'm realizing, gosh, the first thing we do when a patient shows up in the ER, because as GYN, you would cover ectopic pregnancies, people who are hemorrhaging, vaginal lacerations, like all the things, right? You're running out in the ER 2 o'clock in the morning. And or obstetric patients, preterm labor, I'm contracting, I think I have a UTI. What's the first thing you do is you start an IV.
Right.
You start an IV. So why are we waiting this long for patients to wait until we're in an emergent setting, and then all we're giving is normal saline or lactated ringers, no augmentation whatsoever.
Right.
And then we're like playing catch up, right? Hurry, find the infection, find the crisis, put out fires. I'm like, wait. Why aren't we just treating patients when we see smoke?
True.
Yeah.
Don't let it fester and kindle until it's a full-blown dumpster fire that is the Western conventional approach right now. And then think we're going to put that dumpster fire back out, pull the things up out of the trash and still use them. Like, no, that doesn't even make sense. And yet that's kind of the mindset in which we've been trained.
Yes.
So as you get into this more regenerative, actual preventative medicine space, you recognize the benefits of hydration in the long run, how it's going to best benefit. And then you come up with a few, and we've given you these sort of prescriptions or recipes in this course of like 3 or 4, or I don't know, 6. I don't know, has anybody counted?
I have no idea.
I don't know. We'll say 3 to 6, a handful of recipes to help you really isolate what is going to be the best thing for this patient, for that patient. So your jet lag patient, your cancer patient, your fibromyalgia chronic fatigue patient, your long haul COVID patients, post-viral syndromes, pre-viral. You know what? Here I am prodroming. I know it's coming because I just got off a plane 3 days ago. So, okay, let's go ahead and get you augmented with some of this hydration with the nutrients, so that their body can begin processing, have better immune capabilities, and kind of dampen that down. And then when you combine that with a couple of IM injections of like some vitamin D, you give them a little Zofran if they've got some, upset stomach and so forth, you can really bridge to where you're maybe not having to prescribe antibiotics every single time. Or if you do, like let's say we're on a Friday, I think this is coming in, great, now you're touching base. Now if you still want to send them home with, let's say, a Z-Pack, and let's say the IV is not quite getting it, then on Sunday you're not getting frantic phone calls left on your voicemail, and they already have it filled, it's at home, they're good, not a problem. So it's really, really a cool way to practice and to kind of get your toes in the water, to have patients have that best benefit. Yeah.
No, I mean,
catch them early.
Definitely.
Yeah, catch them early.
I mean,
Early
it's important, and you guys need to look at it as part of the therapy. There's so many different ingredients, vitamins, minerals, all those things that can be added in that will augment what you're already doing on the patients. I think we lose sight of that because medicine has become very silo. You go see your cardiologist, your nephrologist, you go see your aesthetic physician, and they just do what they do.
And that's it.
And that's it. And I was I talking, or we were filming for other things today, and I was just like talking about like hormone therapy and how hormone therapy affects aesthetic medicine and all of that stuff. And so this all ties into the whole thing of when you're looking at your patients, creating this whole sense of wellness. Yes. And aesthetic medicine is a part of that wellness package.
Yes, 100%.
And so it all integrates and ties in together. And this is the reason why we bring these things to light, because I think we forget that because we get so involved with just the Botoxes and the fillers, and you want to do that, great, beautiful. That's a great time to just, while you're inserting an IV, like you could talk to them about all the different treatments you're going to do on them today for all the aesthetics things.
Yeah, because zinc is huge for tissue repair. It's going to help decrease a lot of that cytokine release. So if you're sticking 30 needles in a patient's face or threads or what have you, you're destroying tissue while you're inserting these things. Inadvertently, I don't know if advertently is a word. It should be. If it's not, it is today. It's been a long weekend already. So, certainly, like, you're destroying tissue, and then you're relying on that tissue repair in order to have that best outcome, right? So zinc, for example, is a huge, huge agent for that tissue repair. Vitamin C is the fundamental basis for collagen stranding. We forget that. Like, we learned it somewhere. First, second year medical school, like read it in a blurb off on the side. You learn to circle that and then move on to the next important question about the nephron.
Yeah.
Oh my goodness. And so definitely, when we come back to that foundation, what are we doing with our aesthetic world is we're trying to get better skin turgor. That's why we do our microneedling and our, all of the RF microneedling and so forth. So you're trying to build that collagen. You're building that elastin, that structure, right? You can throw all the volume that you want, but then if the skin's still sagging, that's a problem. How are we fixing that? You fix that with vitamin C, with zinc. B complex. How are you methylating? Like all of these nuances.
Or not methylating.
Or not methylating like me and my friend here. We're not great at it.
I'm a mother.
You lack the mother effer?
Yeah,
I'm a mother
effer.
MTHFR. I have an
And
MTHFR
if you
mutation.
don't know, little precursor, I think I put it in the course, is that about 10 to 50% of us have the MTHFR mutation, have one of 4 potential gene mutations.
Approximately 40%, right?
Yeah.
And we can't metabolize folic acid. And the chemical folic acid is sprayed onto our grains, our rice. So anything you eat that says fortified or enriched has folic acid, and some of us can't break it down. So we get this chronically low B12. You get GI issues. You get
every issue.
Anxiety. You get depression. You
They're gluten
so
intolerant.
here you're wondering if you're gluten intolerant or depressed or like you're just crazy, and it's like because you're
not methylating.
You're not methylating.
You're accumulating cellular trash, and so and this is an important factor to understand about IVs, because if you're I always give this analogy. If you're throwing a whole bunch of stuff into the mix, but you're not clearing out the old, then you're just going to have a damn mess, right?
Yeah.
So, can I say damn?
Yeah.
Okay,
Darn.
Okay. Darn. You have a darn mess. So I liken it
friends.
to if you've set up for Christmas. Now my daughters have already set up for fall. We are on August 5th. They are ready for pumpkin spice. So we have set up the fall. So now we set up for fall. Now it's Christmas time. Great. Christmas. Yay. New Year's. Yay. Valentine's. Super. It's great. And now we're shopping for St. Patrick's Day, but we still have fall out. Then all the cute stuff at TJ Maxx does not make a lick of difference when you're just piling it on top of all of the other junk that's laying around. You've got to clear out the junk before you bring in the new. So as well intended as we often are with, we'll take this supplement and take this vitamin and take this other thing over here, that's great, but you've got to clear out the trash. And so if you've got a patient with MTHFR mutation, you need to know their homocysteine level. This is an easy lab test.
Yeah.
And if they're not clearing trash, then you've got to get them on that path. Know what their AST, ALT are as well, because that liver congestion as well may contribute to their inability to remove cellular trash. Then you can really work on polishing up those cells, oiling that machinery and helping it work so much better. But you've got to clear out the gunk first. You got to steam clean that engine first before you
and
can
those
oil it.
high homocysteine levels lead to a
They're
lot
no
of debris and cardiac issues, and here we're like, it might not be the food we're eating as much. It might be the crap we're eating.
But
All the seed oils. but we look at that and go, wait a minute, there's an innate issue of lack of metabolism of something here. And if we get down to the like look at the cause, and we can methylate this stuff and really
and it's an easy
healthier.
fix, right? It's an easy fix. And so, and I think that a lot of times with those of us in the wellness space, I think we are good stewards of our vessel, right? Like we eat pretty healthfully. We try and hydrate. Don't
I was
ask me
just
how
in
much I
Hawaii for the last 2 weeks, so just don't judge.
We're not judging the amount
local
of Mai Tais
mocos
that you-
every day.
Girl, they're so good. And it's
they're so
Wagyu
good.
beef. Most of the time it's like Wagyu beef,
It
so
was
it's really
so
like
good.
not so bad for us. But but in general, right, we're not going to the fast food chains. We're not eating like what I used to call pocket food is like the little wrapped lemon loaf in your medical school pocket. Like so you just eat on the go
nuggets
from one
and, like-
surgery to the next. And so we're not participating in a whole lot of that. We go to the gym, we're working out, we're trying to, again, be good stewards of our vessel. Not all of our patients are. So as you're starting an IV, take that opportunity to talk to them about clean eating, about movement, about the benefits of chronic hydration, right? So that we know that those who are chronically dehydrated actually have higher levels of being overweight and obese. And so they did that study in Germany. It wasn't even American food kids. It was German food kids. And they don't allow GMOs and a lot of the toxins here. So just in general, just hydration alone, chronic dehydration can lead to these issues with weight as well. Chronic
They're
inflammation.
substituting with sodas.
Yes,
And
yes.
juices and all these
Juice
other
box
things.
and gummies, and because they're fruit flavored and fruit fortified, and like no, they're not. A gummy fruit is not the same as actual fruit. And so you can just take that simple opportunity to share with patients. And I always say, like, a lemon poppy seed muffin is not lemon. That's not that they're not the same thing.
Right.
So we want to make sure that we're having whole natural foods. And it really takes like all of 30 seconds. Like in the amount of time that it takes me to insert the IV, get it started, get it hooked up to the tubing, I've already given you my whole spiel on nutrition, eating whole natural foods, hydrate regularly, and move at least 2 to 3 times a week. More if possible, but you want to start where your patient's at. And it allows you that opportunity for counseling so that they can have their best whole test or whole health, right?
Yeah.
So in what you recorded.
Yes. Yeah, like
People are
staying
like,
there.
okay,
stay
so all of this
focused.
stuff sounds good. What's in there? Because
Yes.
I think they need to know, because IVs there's just so much stuff that you
stuff.
can add into it.
Yes.
And as you said, you need to start with the foundation. So
Basic.
what are the basic foundations that people
Yes.
out there that don't know? Because everyone's like, I do IVs, and they're like, we just push this, but they don't really know what it is that they're
what
pushing.
it is or what it
It was
does.
just a formulation.
Yes.
So what do we go into this
Yeah, it's
course?
so exciting. So again, the very basics of just like what 3 sizes of catheter you should have on hand, what kind of tubing, where do you get your IV bags? And I think we're giving a supply list as well, like where we purchase the thing. That's half the battle, especially here in California, is where do you source?
That is the hardest thing. I'm like
where
ship
do you
to
source
another
these
state
things?
and ship it to
then
me from there.
And I'll have my girlfriend run it across state
It's a
lines.
hurricane
like a
in
bunch
Florida,
of
we're
drug
done.
runners. It's ridiculous.
Yeah.
Yeah. So really, where can you source it? Legally, ethically, all of that sort of thing. So we go into that. And then we also go into blurbs about what each thing does. This is what thiamine does. This is what biotin does. This is what, folate does, and so forth. So it really breaks down each of these elements. So as you're doing, for example, a Myers cocktail, which is a very well-known, type of recipe, if you will, cocktail, then you understand the fundamentals of why are you putting these particular B vitamins together with the vitamin C, with the calcium glucarate, and so forth. So it's really a very detailed seminar where you're getting the juicy stuff with references given, so you can go back and read more about each of these elements, because I think it is critically
I
important.
think it is critically important. People take it for granted because recipes are just handed around to each other. The pharmacies will give you recipes, and people are like, okay, that's a Myers cocktail, and they'll just shoot it up because they're like, okay, what am I supposed to do? 1 cc of that, 2 cc of that, half a cc of that, and they just shoot it, and then they'll just give this overall broad journalization of what this thing does without really understanding like what is each component, what is it going to do, and is there something where you can tailor it to push a little bit more on this? Where's the max dose? What's the minimum dose on those aspects?
And what are the side effects?
What are the side effects? What are you going to feel?
Yeah, what's fat soluble? What's water soluble? What can you overdose somebody on?
And in this one, I'm actually just doing the water solubles because I think that's like a very straightforward. I don't want to say basic because it sounds like it's remedial. They're still extremely valuable.
Safer.
You start at basics.
And they are safer. And you want to start with I want to start with math class. I don't want to screw this up. Can you overdose somebody on B complex? It's really unlikely, right? Can you overdose somebody on magnesium? I've done it. I've done it. As an obstetrician, they're like, Annie, are you okay? Yeah, it can get a little crazy, a little dicey in there. But that's because we're giving like a 4 to 6 gram bolus in a 3rd trimester twin pregnant woman who's also got cardiac output issues, right? So like you have to try really hard to overdose somebody on magnesium. So we're working with very, very safe levels. And again, go into, well, if you're having magnesium today, you're going to feel very chill, very relaxed. You might be a little sleepy. And I always say, because you're going to feel so good, stay off of your Amazon Prime days because you're going to be like, click buy now. F it. I'll pay for it later. So you just, hide the phone, hide the Amazon cart, not add to cart.
But it's good for sleeping.
It's great for sleep.
It's the magnesium. Is it glycolate?
We use magnesium chloride. And so it's different than magnesium sulfate that we use in the OB world, because the OB world, magnesium sulfate is what's studied. And it's not that I'm recommending you OBs out there use something other than, please don't, because that's where the studies are and that's what prevents seizures, right? And preterm labor. But it induces a hangover. Like you feel like a hangover without the bender in Vegas the night before. There's no great story that goes with it other than you just feel gorked and you're nauseous and you have a headache. And it's awful. And so when I'm reading about the benefits of magnesium, I'm like, but why would I do that to a paying patient? They're never coming back. This is awful.
Like, I'm not doing that again.
I feel like hell. And so it's reasonable for them not to want to do that. But certainly with magnesium chloride, you don't have those same side effects. Now, do I think they should maybe look at studies?
Yes.
In the OB world, maybe. But it's just always tough to get studies pushed in that space. And I don't do OB anymore. But yeah, magnesium chloride doesn't have those same ill effects, but has all the benefits. So it can help with GI upset, it can help with nausea, it helps with sleep, with anxiety. It's a smooth muscle relaxant, so it helps with blood pressure issues, uterine cramping for your premenstrual folks. It's just a really, really cool tool. And again, something so simple. It's just magnesium, whatever. Yeah. But when you're infusing these things IV, you're bypassing your first pass metabolism, right? And so you're not having to take as much, and you can get to serum levels much higher than what your GI receptors would allow you to absorb. So just taking like your mag-threonate or your magnesium glycinate supplements, again, not to belittle those. I use my magnesium threonate all day long, all night long. But nonetheless, like you can't absorb enough to get the benefits that you would get via IV. And that's why IV is such a benefit. And we go into that, like why is IV vitamin C better than oral vitamin C? Like, can't I just go get some Emergency at CVS? Like you can, but you're not going to absorb to get the serum levels to get you to those oxidant levels that we want. First of all, antioxidant for antiviral, but then oxidant level for things like anti-cancer, anti-huge viruses, chronic Lyme, etc. So we get into that, like why one is maybe better than the other.
How often can people do IVs? Because that's something, you know, that I think everybody should at least have a base for.
Yes,
How
of
often
course.
can you do these type of IVs? And
So if I'm treating like a chronically ill patient, let's say fibromyalgia, chronic fatigue syndrome, I will usually start them on once a week for 4 weeks and then space it out to once a month. I would say in general wellness world, once a month to every 6 weeks, depending how hard you train, what is your sweat equity, right? Like how much are you putting out? How much do you absorb? Like I don't absorb anything. I've had gastric bypass. I think I go into it in the thing. I don't absorb anything. So I need IVs on a fairly regular basis just for malabsorption. And I feel amazing. So, you know, utilize it to your patient's best needs. If you're treating an acute viral illness, I'll go on day 0. So when they present, and then like day 3 and day 7. So if you're treating any sick patients, and I know that kind of in the aesthetic world, maybe not, like maybe if you're seeing like 14 neurotoxin patients today, you don't want the sick viral patient in the back room, but the need sometimes arises. And so it gives you an opportunity to lay eyes and lay ears with your stethoscope, make sure they're not turning into a pneumonia. Are you getting better with the therapy? Then otherwise we need to change course. So I like to do day 0, day 3, and day 7. For those individuals. And again, we get into like, when would you not, right? So you don't want to do consecutive days for somebody who has CHF history or pulmonary edema history or, you know, end stage renal failure, that kind of thing. You want to be very cautious about the volume, age of the patient, right? A 25-year-old heart is different than a 50-year-old heart or a 75-year-old heart. So we want to act with caution. Rate, like how fast are you infusing these things? So I sent my husband, that poor man. That poor man. Full-blown panic attack. The man never has a panic attack ever until I like bolused him. All the whole Myers cocktail. He's like, hurry, I gotta go. I'm gonna catch a plane because he travels a lot. I had to catch a plane, la la la. And I'm like, all right, let's go. So we open it up wide, and then he's like coming out of his skin because it was just too much too fast, right? Because the B vitamins are very elevating. You feel great. It's good until we don't. And now we're like raging. And he's like, what is happening? You know, I'm like, oh God. Like, all right, sit down, you know, like slow it down. The good news as well with a lot of the water soluble agents that we're using in this discussion is that you can just slow it down, slow the rate down. And a lot of the symptoms go away, and then you can titrate it back up and, you know, speed it back up a little bit. Most of the IVs that we're doing are going to take about 45 minutes depending on the flow, right? Like what size catheter do you have to do? The back of the hand, little spindly 75-year-old. Are we doing a straight up AC with a 20 gauge, right? So we go into all of that as well. And then even with NAD, I didn't get into NR, but with NAD, it's a longer process. It's much, much higher.
Do maybe a little discussion about NAD, because I know it's very popular in the aesthetic world. Everyone's
talking about it.
Everyone's talking about it.
And we're seeing where too much can be a problem. But, you know, NAD is only absorbed by 2 forms of tissue, which is cardiac and neuro. So that's probably why people have such an awful feeling when when they
get it. Yeah. It is a full-blown panic attack.
Yeah.
And you feel like your chest is squeezing, and the nausea, and I can't breathe, and my jaw clenches. And so, again, if you've prepared your patient and they know that this is coming, and then they call you. So again, we talk about having a little bell, some kind of call button in each of the rooms, so that as you start your patient, they can give you a little quick ring, and then you just come in and just reassure, slow it down. Usually the symptoms will pass in about 15 to 20 seconds, and then you can go back up just a skosh, just a little bit, just to keep it moving. So we talk about the prehydration aspect of it, preloading with glutathione, these kind of things. But NAD is a fantastic tool. So for those of you who don't know, it stands for nicotinamide adenine dinucleotide. Please practice that in the mirror. I had to practice it for like 3 weeks. I can't remember the damn thing. So it's one of the cofactors for pushing the Krebs cycle. So as we're taking in oxygen and glucose, and I didn't like this stuff.
I hated this stuff.
I hated Dr. Kick with a passion. Not the man personally, but he was our biochemistry teacher. I was like, this is lame. I hate this. This is stupid. Nobody's going to remember the 22 enzymes of the Krebs cycle. Now, I only know there's 22 because then when you had to draw it out, you counted. And if you only had 21, you knew you were missing somebody. Don't ask me what they are. But NAD, you use 3 NADs, which get reduced to NADH in that process of taking oxygen and glucose to make your 36 ATP. If you are not doing this process efficiently, then you switch over into anaerobic metabolism, and with that molecule of glucose, you are now making 2 ATP. So you're 18 times less efficient in your energy production when you don't have adequate NAD. Typically, we should have about a 700 to 1 ratio of NAD to NADH. And most of us beyond the age of about 25 or so, we just are not building it appropriately. We're not reoxidizing that NADH back to NAD, so we're not upcycling back to NAD as efficiently. So we're at about a 300 to 1 ratio. So we're like less than half as efficient, and we feel it, right? This is why when we wake up in the morning, we're creaking, we're cracking, something hurts, we like half our hair is on the pillow. Like, why am I not feeling great? Especially when we're doing all the things, right? Again, in our space, oftentimes we're doing the thing. I'm taking my fish oil, I'm taking my probiotic, I'm pooping every day, and like I'm doing all of it. Why am I still feeling dragging? How come I can't focus? I can't synapse. I can't process new information. Why does everything hurt all the time? Why do I get so much anxiety? And a lot of times it's because we don't have enough NAD. Now the difficulty, and maybe somebody out there can help us, there's not a great commercial assay for checking this. Right? So there's not like, I'm going to send it to LabCorp and just check your NAD levels, right? And this would be beautiful for marketing because then I can show you on paper you are deficient in your NAD, but there's not a great one. There's a couple of private ones that you can buy from like A4M conferences. They have the vendors. But even then it was at an expense, and it still took like 2 days to return. So if I'm seeing you right now today, do you have good NAD? I don't know, like I still have to ship it out. It's an expense to you that you could have otherwise utilized for your neurotoxin, your filler, your IV series, your HRT. So I had to just put that in there. And you're waiting 2 days for it to come back. And by then, I don't know, I'm busy. I got to pay for my kids' volleyball tuition. Like, I don't know, it's first of the year. We got to order uniforms. I don't know. I'll think about it later. I'll think about it. So it's a little bit tough. So it's still kind of a clinical diagnosis. So yes, we know these stats, and it's based on lab assays that are available in research setting, but not really available for us common folk
so
yet.
Just in the NAD world, just because there's so many arguments on that, I don't know where your opinion is. They have the oral form. Then they have the new things that people are starting to do, just injections. Versus actually now doing it as an IV. Like, what is your opinion with regards to that? And
so NAD orally doesn't really absorb appropriately. NAD is kind of a complex molecule, and so you've got to rebuild it. So you've got to then ingest it. You have to have the microbiome to break it down, absorb it, and then reassemble on the other side, right? So that's a lot of ifs. And so if your body already sucks at this game, which it does, or you wouldn't be asking me for NAD, then if it didn't suck, you wouldn't be here. So clearly it sucks, right? And so really to rely on your body to do this process on its own, it's not great. NMN, from what I understand, the research that I have done on NMN is better absorbed. So this is kind of the precursor to NAD, but you still have to have several of the NMN molecules come together to make NAD. I think
And
it's
that
two or
only
three.
bumps, like you've read Sinclair's book.
Yes.
Okay, so that only bumps up your NAD by about 60%
Yeah. Which is better than no
but
things.
I have an oral supplement that's called Nuchido Time Plus. Did I tell you
I don't know
about
this one. I don't know.
That will bump up your NAD production by about 243%.
Well, okay then.
And Dr. Nicola Conlon out of the UK, who's a brilliant scientist, has done a lot of research where she's looking at elongating telomeres and actually seeing that it reverses the biological clock.
Nice.
So
Beautiful.
I have that I sell at my clinic. It's on the link in my Instagram. You can buy it through
Find
that.
me, it's down below.
But
I don't know if it's down below. But
I
it
think
sounded
it's like the link in my Instagram, whatever. But you click on the link. It's called Nuchido Time Plus, and I put that in with packages when people buy something that's going to. I need to stimulate collagen. Like we were talking about, they need the foundation.
Yes.
Aesthetics is not just the wrinkle anymore.
Yeah.
It is looking at that patient holistically.
Yeah.
And it's saying, okay, if I want to put Sculptra in you or a hyperdilute radius, or if I want to do radiofrequency microneedling, if I want to do something that's going to cause your body to try to build collagen, I need to give you the foundation.
Yes, we need the
I need to
elements.
make sure that you're on bioidentical hormones.
Yes.
I need to make sure that you have the proper
We need the Legos to build the
Legos,
tower.
right, to build what I want to build. So
Yeah.
I put the Time Plus into the packages.
Oh, sweet.
So they buy the package and they get the Time Plus in there because I tell them I want you to have the building blocks.
Yeah.
And some people take oral collagen. Your stomach's just going to
Again, it's a
destroy it.
huge
Maybe not
molecule,
your
guys.
stomach, but my
Yeah, 'cause I don't
stomach would
have a
destroy it.
stomach.
She has a stomach.
Yeah.
but the oral collagen, your hypochlorous acid will break it down.
Yeah.
If you take the building blocks, which are the amino acids, so sometimes it says collagen peptides. Yeah, you're just giving your body amino acids. But where are they going to go? I don't know.
Huh?
Wherever your body wants it to
down
go.
if
It
you
might not
like
go
it.
to your skin.
Yeah.
So there's
Yeah.
so many like ifs. There's so many
many
things
nuances.
that
And-
I think in between IVs or doing NAD, if you want to do NAD by IV, great. But I love taking the oral supplement
Yes.
to keep that level where,
Yes.
so our own body, it's not oral NAD, it's supplementation that helps your body
Build
make
the
your own
NAD.
NAD.
Yes, and I think that that's kind of where these oral supplements
Yeah.
are going to be heading, because I think
Yes.
more and more people are understanding that NAD is not really well ingested orally. Now, as far as the sub-Q, I think that it's a good tool, especially for patients who don't respond well to like a B12 injection. So again, I'm MTHFR patients and so forth. So they may be able to do an NAD injection just to the lower abdomen typically.
Right.
Very easy to do. It's nice because it's short and sweet. They will get a bit of boost of energy, a bit better sleep, but they're probably not going to be able to clear out the whole hall closet, and definitely not getting into the garage, right? So their element of being able to like go in and rage clean and have all this energy and so forth, And how often do you want to be stabbing yourself? So is it going to be, again, and this is...
getting high enough. I mean, even
Yeah.
with NAD as an IV, from what I've read, you need to at least hit 500 to really get what is
Get to a
considered
level.
effective. People
Yeah.
typically doing 250 just because it's tolerable, but it really is not.
You're not getting
enough.
therapeutic.
You're not
And-
getting therapeutic.
Yeah.
So
Have they
hit
done
therapeutic is
research
500.
on the effect of NAD? We see negative with cancers and things that too much, but have they actually looked at longevity, at reversing biological aging, at telomeres? Have they looked with IV NAD? Because my concern is the cardiac and nerve tissue. So it's not, we're not getting it absorbed in other tissues per se.
Yeah, I don't know that they actually have. Like, I haven't seen the studies one way or the other
Yeah.
to see if they have it out there. I'm sure somebody's done it, but I just haven't read it.
I haven't either.
But I feel like NAD is one of those basic elements, just like vitamin C is a cofactor, zinc is a cofactor. Like, are you really doing additional harm to it, to tissue? I think that I think it comes to a matter of, are we doing benefit, or are we just not getting much of a benefit, but different than harm, right? So I think the metabolic pathways of cancer cells, for example, that's where things get dicey with glutathione and NAD and this and that. And so that's a whole separate conversation for sure. But when you're looking at healthy tissue, like presumably healthy tissue, which a lot of the aesthetics folks are we at least getting some benefit? in all tissues, most tissues, some tissues, because again, if my cardiac tissue is working better, then presumably all of my blood flow is going to be better. So I'm delivering these nutrients better. I'm taking away trash better. So I think still it's giving us some benefit. And again, the neurologic, you know, the brain runs everything, really.
Yes.
So if we can get the brain tissue better, and even though most of us die of cardiac issues, we always worry about our pap smears and our mammograms, but we worry most about dementia.
And now we know it's not a cholesterol issue.
No,
it's an
not.
inflammatory issue causing cholesterol deposit. This is not like our cholesterol levels. Don't get me on this.
Yeah, here we go.
Should be higher.
Yes.
And
higher.
we've with these statins, which have not increased or decreased all-cause mortality by one day
Not one
in
day.
the cardiac world,
Yep.
right?
Yeah, we're not reducing strokes.
But
we're not reducing heart
pharmaceutical
attacks.
companies have made billions off of statins. So my husband had a heart attack last year. I took him off his statin, you guys. Our brain needs cholesterol or we're going to get
Yes.
dementia.
Our
That
sex
is-
hormones need cholesterol.
Cholesterol
Building
is
block.
a good thing. It's not a bad thing. And when we have too low levels, then we run into a lot of health problems.
Yes.
Yes.
The issue is, and a lot of the IV things that you have, you're really reducing inflammation.
Reducing your
Reducing the
inflammation.
seed oils. Watch your intake of what you're eating.
Yeah.
Make sure that you don't have inflammatory. And take some anti-inflammatories. Turmeric, resveratrol. I mean,
Yeah.
some of these anti-inflammatory supplements, that's what I put them
Arnica.
on.
Yeah.
So I think get it at the baseline, and it's not a cholesterol issue.
Correct.
Like,
Not. It's not.
Yeah, the way
Yeah,
I'd say
right.
it is
Low-fat diet killed it
Yeah.
too.
low-fat
Yeah.
diet's been really bad too.
Oh my goodness.
yeah.
Yeah. No, whole fat, all the butter.
All the butter,
I just made
yes.
butter this I should have
Oh.
brought you some butter. I made butter and bread and jelly this weekend.
Wow.
Before I broke. But then she broke. Yeah. But no, it's remarkable. And so we want those fats because about 70% by weight of our brain, it's estimated,
Yeah.
is fat, is cholesterol.
Yeah.
And then every single cell in our body, the phospholipid bilayer,
Lipid
is
bilayer.
made up with lipids or fats. And then again, every single sex hormone is the basis of every sex hormone is cholesterol ring. So what we found with the statins is not only are we not increasing life expectancy, we're not reducing heart attacks, we're not reducing strokes, but we're actually increasing dementia and we're increasing sexual dysfunction. And so we're all wandering around on Viagra and with vaginal dryness and no brain, and we can't remember. like,
Did I take
Wow.
my vitamin today?
like what happened? And so it's just ludicrous. And I think that we need to look at medicine more holistically from a standpoint
Sure.
of lower is not always better, right? I don't like seeing an A1C for that matter of like 4.7. You're not
Right.
getting enough sugar to your brain.
Right.
You are not synapsing, you're not thinking, you're going to have a brain fog and a cloud and irritability because you don't have sugar to fuel.
And that's the whole thing with medicine. We've narrowed it down to one single thing as the issue when it's a part of a whole conglomeration. And we simplify it to that point where
Yeah.
it literally we're destroying ourselves.
No, we are. It's supposed to be like this cookbook protocol medicine. And again, I think that that's the math class, right? Like we want to understand some of these
Right.
fundamentals. Like, yes, it's great. Like if you come in with an acute heart attack, we apply oxygen, we put it on a beta blocker, aspirin, put the nitropate. Like, yes, right? Know that. But then
Yes.
wait. I've seen this patient 4 times this week, and it's actually her panic attack, so we probably don't need to do the nitropase because you're going to bottom her out. So we have to have that element of critical thinking.
Yes.
And I think we've lost a lot of that. So
Oh.
it's-
You think?
yeah.
The art of medicine.
The art of medicine. And so as you get
art
good
of critical thinking.
with yes, and we're not rewarded for it.
Yeah.
Nope.
And this is where I think a lot of us are found in this aesthetic space, in this alternative new old way of thinking, because this was the old way of practicing
for
medicine. Is
sure.
you looked and evaluated your patient, you knew how to read their irises, you knew how to read their tongue, their feet, their energetic fields. Like we knew how to do this as providers, and now we don't. It was sort of beaten out of us a couple generations ago, and now it's just basically symptomatology equals diagnosis equals pharmaceutical. And again, it's not to say there's not a role for pharmaceuticals. Sometimes we need them, and they can save lives and change things. I mean, we all love penicillin from the 1930s. Thank God, killed syphilis. It is still the only adequate medication for syphilis, by the way. So if you have a penicillin allergy, you just have to desensitize the patient and still treat them with penicillin. Little fun fact, I'm full of them. I'm going to do like a whole series
Wow.
of medical history. But I think that understanding the fundamentals of how the biochemistry fits together, how that's part of a bigger whole, I think that's what it comes down to, that we need to have a fuller understanding. That said, have humility and grace. None of us know all the things.
None of us know all the things. I think medicine, unfortunately, it's stuffed down our brains, and there's a lot of people that literally have, you know, swallowed the Kool-Aid.
Yes.
Because that's what
and if you pass the test, though, that tells you that I know everything, right? I passed my board, so of course I know everything.
Well,
So this God
we've
complex.
seen the opposite of that lately.
Little bet got into an Instagram argument over the weekend. But it is tough. It's a tough ego pill to swallow that I don't know everything. And, you know, I don't know which philosopher said, well, we're going to blame Socrates on this one. It's like, if I know everything, I can learn nothing.
Sure.
Exactly.
So I have to come with an open mind, an open heart, and a graceful spirit, because if I then beat myself down, like I'll still go to hormone lectures, like seminar series. I don't know what the hell they're talking about. I've been prescribing hormones for 20 years. I think I'm kind of good at what I do. I have no idea what these people are talking about. I don't know what studies they read. Maybe every now and then I'm like, oh, wait, I read that one. Nope, lost it. No, I don't know which one you're talking about. And so it can be very frustrating. And I beat myself up like, why didn't I know that? How, like, I'm supposed to be a professional. I call myself a master at this. Like, there's no way.
So much information.
And yet, you know, when we understand how many gazillion processes are going on in the body, there is no way to understand all of it.
And our level of knowledge changes every day.
Every day.
So if we don't keep up on things like webinars and these if we don't keep up on things, we get left behind.
Yes.
And even further behind.
And I think it's important to understand the fundamentals and revisit the fundamentals. So if you are an expert in aesthetics and you've been doing this for 20 years, come back to the fundamentals course, because you're like, shit, I forgot the corrugators also do this, or I forgot where that vasculature was. And so just coming back to those fundamentals is key, because I've gotten ahead of my skis as well with I suffer from shiny object syndrome. I'm not gonna lie. I love the newest, latest, oh my God, wait, you could do this? Oh, there's this peptide? Oh my gosh, you can do this? When it's like, dude, just check levels. Like, what does their inflammation marker look like? Where are their hormones? What is their vitamin D? Okay, can we just go back to taking our vitamin D?
Go back to the basics and the foundation. And you need to start off with that. And I think a lot of the people in the wellness world, as we see the shiny new objects, go to the shiny new objects, and you're doing peptides. But if you're doing peptides, you need to realize, if you haven't foundationally changed the body, those peptides can actually push you in the wrong direction. Because you actually have not grounded the person in what needs to change. Detoxing, all of those things first. You know, there's a lot of foundational things that people don't even think about, because they're like, that's what the study said. It did this, not realizing that just by doing that, you could push the patient overboard. Even though it's documented that this great thing, because they need a foundational change in what needs to actually
you've got to fertilize and amend your soil before you can plant seed. And you can't just plant seed in fertilizer, right? So too much of that good thing is not a good thing. And so it's understanding this give and take, this balance that makes us so beautiful. I mean, that is what is the gem and the art of what we do, and that every patient is different, but there are some fundamentals that sort of don't change. And so, you know, having that grace, because when I first got into IVs, I was creative and I was gonna make this little fancy mix over here and that, but it wasn't reproducible. My nurses didn't know what the hell I was doing. A patient would come in 2 weeks and say, well, I want what I had last time, and we have to like go scrambling through, instead of just like, oh wait, did you just get an immune complex? Okay, great, it's B complex, zinc, and vitamin C. Very simple, very basic. Well, can I also, because I'm a little nauseous today, I'm hungover, can I get something for a headache? Okay, well then we'll add a little Zofran, we'll add a little Toradol, right? Remind me about your kidney function. You haven't had kidney issues. Okay, great, good. You're going to clear this just fine, right? So you can easily morph from that basic, you know, if you understand how to build out from there. Then you can get super fancy, and it's really, really fun. But being reproducible, allowing your staff to be able to come behind you and know what the hell you did, and so then they can re-implement that and do it on a day that you have off. Right? Because the idea is that you're not building your finances so much as you're also building your time finances, right? Like, what is the time you have to be able to take your kid to volleyball practice while my staff is able to carry on without me? And that is invaluable.
Yes, very true. So, I guess
we are like
we
over
need to
5
wrap
minutes.
up a little bit,
my goodness.
But
we could talk forever.
This IV course that we put together is foundational. We will keep adding to it. So look out for it as we add another section to it. Things, more of the crystal shiny balls, the things that sparkle that we want
Yes.
to add into it. But we really wanted to start off with the foundational things. These, I think you can do on everybody.
Yeah.
These are foundational. Start off with these, and then
Your mom, your siblings, your spouses.
and then we'll
always the
keep
spouses.
adding on to this and keep expanding upon it into another IV course that's gonna have all the shiny bells and whistles.
I love it.
Absolutely.
I love it. Thank you.
Yes.
We're going to continue our conversation on our mentorship call next, which I mentioned on our Founders Club. We have a live call, so we're going to continue this conversation on our mentorship call, which comes up in about a half hour, I think. So, thank you so much for joining us. We really
you for having
appreciate it.
me.
And
I
you're
always
gonna,
love
you
you
guys,
guys.
you see how fun she is. You're gonna. This is
You're
why
gonna love
she's
her.
my doctor too.
And then
Little
of course,
hormones.
Look at she's so
look
strong.
out for the
My
hormone
hormones, yeah.
one in the new year, but we will announce that again. Again, if you want to rewatch this will go up on the Aesthetic Immersion YouTube channel. So watch out for that. That should take about a week for that to go up. And of course, this will be also offered as a podcast on those podcast things that are out there. which I don't
Spotify
know,
and Apple.
Apple,
Yeah.
blah blah blah. But next time, September 2nd, we're going to be talking about marketing momentum, turning this strategy into success with Enoch Kwok and Jared Rohr. All right. So thank you so much. We'll see you at the next AI Live.
Thank you for watching.
And don't forget to like this video and subscribe to the Aesthetic Immersion channel.
And check out all the other videos we have to offer.